So historically, there's a couple of really strong factors within government that have put the brake on what I would call really progressive early intervention thinking. And this goes back to the start of the welfare state back in the 30s and the late 20s, is this idea that, first of all, the individual and the family should be the primary movers as regards the care for their own. So there's this dynamic that is still true to this day, that government should be there, but only for those who truly are in a state of emergency, because they clearly have not been able to take care of themselves at the front end. And we should not deny them the chance to pull themselves up and have that opportunity to have overcome an obstacle. So that's one big one. The other big one, I would say it's even bigger, is this idea that we have scarce resources, that we don't have enough to do everything. We've got to make a choice. So what is most important? Well, most important is obviously intervening when people's life, people's health, people's safety are at imminent risk. So that has political implications as well, right? Because the last thing politicians want to do is be accused that emergencies are not being taken care of. It makes a certain amount of sense, right?
But it puts us in crisis mode.
So we are always in crisis mode. So not only, does this fit with this kind of sense of a bootstrapping population that needs to let, individuals and families take care of itself, it also, within an environment of scarce resources, puts us where apparent emergencies are. But what it doesn't do, of course, is really solve the problem. So this is what the book really is about. This is the proposal. This is the proposition in early intervention, is that the evidence is now in place to a large degree, not only about the social, physical, the health outcomes that are improved by intervening early, and we can maybe go through a few examples in some of the social service areas we mentioned before, but the economic argument is now available to us as well. This is fairly new. So, if politicians have been accused in the past of closing their eyes to the economic opportunities that come with early intervention, they really can't anymore, because to a large extent, the case is now being made. We're going to have to make it increasingly in a more refined way, in a more precise way, but we do have the economics for arguing, for instance, that intervening early in child protection with families at risk is a great investment. Remember, we live in general in an environment where investment is a positive thing. It's seen as positive when it comes to repairing bridges, when it comes to repairing roads, when it comes to repairing physical infrastructure. And we say, well, if we put in money today in those areas, let's do the cost calculation of the lifetime of the asset. What's our return on investment? That's the language that is used. And what I propose in early intervention is that we use the same kind of logic, the same kind of math to say, well, what are the returns on these investments we're making in human capital and human assets?
So often, though, we think of government spending on the social and government investment on the hard and infrastructure.
Correct.
And that twigs so many different assumptions in how people see it. Spending, you don't see it as a return on that spending.
Right. And it's don't want to go too long on this, but it's hard to be a politician, right? You have immediate political needs. You have to get certain things out the door, like an annual budget. You only have 3 or 4 years in a political mandate. So these make it very tough on politicians and their senior civil servants to really bring reform.
Well, and this was going to be one of my questions next. Is sometimes you see the return on investment of investing in children, and it's a 15-year trajectory before you see the return on that, or you see complex returns on the investment. So I think of incarceration. So you prevent someone from going back into the prison system because you've put the right investments in their exit from the prison system, and you can claim all kinds of savings to the criminal justice system, to the health system, to the so on and so forth, but those don't get distributed necessarily right back into the coffers. So it's harder to make that argument.
It really is. I really love your term, complex returns. See, that's part of the problem. The returns on investments in humans and in communities are very hard to quantify, and even if they are quantifiable, the problem is they get dispersed, as you say, across a whole variety of different areas.
Right.
And we still work in government in a very siloed way. This is my Department of Social Services. What's the impact on my budget in this fiscal year? Because that's what is expected of me, is to hit this target. And so any investments I make, I better get them back. But that's the kind of thinking that I think we can really improve on.